Hello everybody, my name is Dr. Dan Perman, and today we are going to be talking about concussions. What is a concussion, what causes a concussion, and what can we do to help rehabilitate concussions? Something that I am extremely passionate about because this is a group of people who, most people will heal, but those that don't are oftentimes left, shrugging their shoulders. They don't really know what to do, but there's really so much you can do for these kinds of patients, and we're going to talk a little bit about that today. So a little bit about me. I am a chiropractic neurologist. I am a clinician here at Root Cause Medical Clinic, where I do neurological rehabilitation. I am the owner and founder of Virtual Brain Rehab, which is a virtual clinic for people who don't have the accessibility or are not close by enough to receive these kind of neurological rehabilitative treatments. But to be honest, being in person is always going to be better. So that's why I love being here at Root Cause. Not only does it let me see people in person and do things I can't do digitally, but also having an amazing team of integrative practitioners to deal with all sorts of other aspects of your health is extraordinarily beneficial for people dealing with the kinds of conditions that I work with. Again, I'm a board certified chiropractic neurologist. That's about 3 years of extra schooling on top of my doctorate, where I focus on diagnosing and rehabilitating various neurological conditions. Now, I've primarily focused on the migraine, the dizziness, and the concussion. Because that's just what I'm passionate about, and they tend to respond really, really well to these kinds of conditions, to these kinds of treatments. But I also enjoy, working with people with stroke or with tremors, things like that, chronic pain. There's really so much that can be done non-invasively to rehabilitate these kinds of issues. A little bit more about me. I've always been into neuroscience. I did my undergraduate degree in behavioral neuroscience while I was in school. In college, I worked as a research assistant at Harvard Medical School doing neurobiological research. I thought about going into laboratory research, but figured I really wanted to work one-on-one with people, so that's what kind of led me down the path that I am in today. So I want to start a little bit about really what concussions are and just some facts about concussions. So there's over 200,000 hospitalizations each year for TBIs, or traumatic brain injury is what that stands for. But here's the deal, that's only people who were admitted to the hospital. That's really serious issues. That's not the people that just go to the hospital once for a checkup, people that go to urgent care, their primary care doctor, or the many that, hit their head, ring their bell, and then they end up with symptoms, but they never go about getting it treated. It's actually estimated that there are millions of concussions that are occurring every single year. It's just so many people don't know that they should even go see a doctor for it, and the people that are just going in for a general visit, those stats aren't really tracked all that well. So this is a huge issue that we haven't even really been able to quantify yet. Now, the majority of traumatic brain injuries are considered mild traumatic brain injuries, or MTBI. Another word for an MTBI is a concussion. Now, all concussions are MTBIs, but not all MTBIs are concussion, but that's a conversation for a completely other talk. But for our intents and purposes today, we're going to consider mild traumatic brain injury and concussion the same type of thing. Now, there's a misconception as to what needs to happen to sustain a concussion. Oftentimes we think that we need to hit our head or we need to lose consciousness, but honestly, this is really not true. In fact, most concussions, you do not lose consciousness. And any kind of even whiplash trauma where the head whips back and forth can also cause a concussion. And that's because a concussion doesn't happen when you hit your head. It happens when the brain bounces around inside your skull, but we're going to get to that in a little bit. Falls are the most common cause of concussion, but also, sports, motor vehicle accidents, getting into a fight or something like that. Those are also very, very, very prominent causes of these kinds of head injuries. Now, luckily, over 80% of people that sustain any kind of concussion, they're going to heal symptomatically within a couple months. The brain is really, really good at healing for the most part. It's this extra, 15 to 20% of people who are dealing with symptoms longer that I tend to see and focus on. I really like to, it's always good to get checked out in the beginning if you do have symptoms of a concussion. It's good to have somebody take a look at it, but most of the time we say just monitor the symptoms, get some rest for a couple days. We'll get into that a little bit too. And let's see how you heal up on your own. The people that are dealing with symptoms for longer than that are the ones that require a little bit more rehabilitation. But to be clear, most of those, 15 to 20% of people that don't heal on their own within a couple of months, most of those people will also heal. It just takes the right amount of time and the right types of rehab. Now, there's a lot that's changed over the past, decade, 20 years about what we consider the proper treatment for concussion. Up until, 5-10 years ago, it was thought that you just rest after a concussion. Now, that is what you're supposed to do for about the first 72 hours. You want to give your brain a little bit of a break. But after that, it's actually not beneficial. We want to get moving as much as possible. So after those first 3 days of resting, if you're still dealing with symptoms, it's really important that we're starting to, get moving a little bit, try to get back to your daily routine. Watch out for your symptoms. We don't want to push you too hard, but the best way to get you back to normal is to start getting some activity done. At that point, it's really a good idea for you to get checked out by someone like me so that we can quantify the issue, see whether or not we think this is going to heal up within a couple months, and get you on a treatment plan if necessary as quick as possible. Now, most of the head injuries that are occurring each year are mild traumatic brain injuries or concussions. And these are caused by a bump or a blow or a hit to the head. So, you are more likely to sustain a concussion if you do get hit in the head, but it doesn't need to be that. It can be a hit to the body that causes the head and brain to move around. Because when the head is moving around quickly, it causes the brain to bounce around and twist inside of the skull. And this causes injury to whatever parts of the brain come in contact with the skull, but it also leads to shearing and stretching around certain parts of your brain, which leads to damage in those areas. And that's going to be really important for what we talk about in a little bit. Now, what's basically happening when the brain hits around inside the head is different chemicals are released, which leads to different types of inflammation and symptoms, and it can lead to a whole slew of issues. That's why it's really important that we take those first 72 hours to rest after a concussion so we can let those natural chemical processes carry out. It's important that we don't go too hard too fast when it comes to these things because if we do, it can be not so good for you. Okay, so because your brain is bouncing around in your skull with a concussion, you can experience virtually any kind of symptom as a result of it. But there are a few hallmark symptoms that we see in virtually every concussion. That's headache, tightness, pain, dizziness or imbalance, nausea or vomiting, light sensitivity and blurred vision, and fogginess. Those are the hallmark symptoms of a concussion. So, if you experience those after a head hit, there's a good chance that you sustain some kind of concussion. Of course, there's a good chance it's gonna resolve on its own within a little bit. But if you're experiencing those symptoms, there is a chance that you did injure your brain just a little bit. Some other common symptoms are ringing in the ears, fatigue, changes to your cognition. So, feeling clumsy or forgetful or just, not quite as sharp as you used to be. Sometimes emotional changes. Sometimes people feel more irritable or they're more quickly to cry. And then also sleep abnormalities. A lot of people have difficulty either falling asleep or staying asleep, or sometimes they sleep too much and they can't get enough of it. All those are issues. But those, again, tend to resolve as we start to rehabilitate and get things, back to normal. Sometimes we may need to refer you out to different specialists to make sure that we're crossing our T's and dotting our I's. Like if you have ringing in the ears and it's persistent, we may want to get you to an ear, nose, and throat doctor to check that out a little bit deeper. But again, most of these things do resolve over time. Now, this is a very, very important concept, kind of the most important concept here. And this is going to describe why we experience those common symptoms, the headache, light sensitivity, dizziness, nausea, tight muscles, all that kind of stuff. No matter how you hit your head or no matter how your brain bounces around in your body, there is always going to be a stretching and shearing tension on what's called the brainstem. And the brainstem is the anchor of the brain. It's the part of the brain that deals with a lot of our unconscious processes. So it deals with regulating our vital signs. It deals with setting the tone of our neck and back muscles. It deals with coordinating eye movements, making sure they're moving smoothly and accurately. It also deals with pain. So it deals with making sure that we're not experiencing pain all the time. It helps set the tone of our muscles along our shoulders and our hips. It deals with, our fight or flight response quite a bit. It helps with our balance and our coordination, and basically all the things that you really don't have to put too much effort into. And when those areas are injured, it basically causes the brain to lock down on itself, because the brain cares about survival more than anything. So if your brain is starting to have issues with your vital sign regulation and all these things that are incredibly important that your brain typically doesn't have to put that much effort into, it's going to put all of its resources into that, which is going to give you pain, make you dizzy, make you super fatigued, make you super foggy, because your brain would much rather focus on keeping your heart beating correctly and your lungs breathing than it does about you remembering a phone number. So this is partially why we feel foggy and just kind of out of it after these kind of things. One, because we might damage the parts of the brain that allow for clarity, but also because we're stealing resources away from the brain to keep all these vital processes going that keep us alive. I have a visual here to kind of demonstrate what happens to your brain when you sustain a concussion. So let's break this down a little bit. We have a punching bag on the table. The punching bag itself, that's the brain, or what's called the cerebrum. That's the big main part of your brain. Now the spring, that's the brain stem. So that's what we just talked about, the part that does all that vital sign regulation and all the unconscious activities that your body needs to do. Then my fist there and the table, those are going to be both sides of the skull. Now let's see what happens when we hit the brain, when the skull hits the brain. So you'll see here that as soon as my fist or the skull hits the brain, there's a deformation of the bag. Then when it hits the table, there's another deformation of the bag. These are the areas of the brain, the main part of the brain, that are typically going to be affected. Now you'll see the brain stem or the spring there, there's tons of bend and flex in it, no matter what direction the brain moves. This is basically what happens when you sustain a concussion, and it leads to shearing and tearing of the brainstem cells. So this is what we're seeing in virtually every concussion. No matter how you hit your head or your head is jarred around, there is virtually always going to be a shearing force on that brainstem, which is what leads to all of these common symptoms of concussion. Okay, now what do we do to actually fix this? Again, most people are going to heal on their own, but after those first 72 hours, if you're still experiencing symptoms, I would see a specialist. You can start with your general doctor if you want. You can go to the emergency room. That's totally fine. There's typically not too much they're going to do for you, but they might guide you in the right direction. I would recommend either seeing a medical neurologist so that they can quantify the issue, or a neurological rehab expert like me to start to quantify what's going on here and see the likelihood that you're going to get better. Now, getting checked out in an office like mine, and this is similar in the medical neurologist's office, we have to test all the functions of your brain to see what's working and what's not working as well. So, my assessment starts with a history. I want to really understand what happened, because that does help me. But from there, we need to pull apart every single function of your brain to see what's doing its job and what's not. So to do that, we look a lot at balance. We'll look at your coordination. We look at how you're moving, like how you're walking, for instance. We look a lot at eye movements, because we're seeing that more and more research is coming out to show that eye movements and pupil response, so how your eyes change, your pupils change size in response to light, are really good predictors of concussion. So we look a lot to that. Sometimes we might look at reflexes or feel your spine, feel your muscles. We might see how you dual task, but how you do when you focus on more than one thing at once. We may take a look at how your inner ear is functioning, also known as the vestibular system. And then if necessary, we'll look to ordering labs and ordering imaging. Most of the time that's not necessary for concussion, but it can be in certain instances. So if we need to do that, we will obviously do that. And for lab testing, we have an incredible team here in the functional medicine side of things to do that. The examination for me typically takes 30 minutes to 60 minutes or so. It can be taxing sometimes, so I usually make sure that we're communicating throughout it. Let me know if I'm pushing you over the edge. If we have to split the exam up over 2 days, we can. My goal is not to flare you up, but as we're testing these systems that might be injured, there is a chance that your symptoms might come on. So, now what we want to do, when we start to rehabilitate you, we make sure that we're not pushing you over the edge. But sometimes the exam can really take it out of you. Okay, now let's go into concussion rehab itself. So what do we do to rehabilitate it? Well, we know that the inner ears can be involved in this. We know the eyes can be involved, the muscles and joints can be involved, and the overall brain can be involved. So we do therapies to look at all of that. We might do vestibular rehabilitation where we retrain your head movements. We might have the PT team do physical therapy kind of stuff with you where they're working on stretching and exercises and physical type of routine. You might get an adjustment by myself or Dr. Alex or something. We might work on your reaction time. We might work on your peripheral awareness, where things are around you so that you can understand your environment a little bit better. Sometimes we might do some cognitive exercises where we really challenge your brain and get you to think a little bit. We might do some balance and coordination exercises, but we also do some electrical stimulation. So there's two main types of electrical stimulation I do. One that stimulates the nerves in the face, which feeds right into the brain. It's a good activation there. And another to exercise what's called your vagus nerve, which is our rest, digest, and recover nerve. It's the nerve that kind of takes us out of that fight or flight mode and allows us to recover a little bit better. So I have an electrical device that I use to help stimulate the vagus nerve in that way. Now, if necessary, we can do nutritional and hormonal interventions. There's a ton of research on omega-3 fatty acids and concussion. So, it's usually advised that we have a good dosage of omega-3. Hormone regulation sometimes can be off with concussion. I usually don't mess with hormones too much, but we can go down that path if we think we need to. Now, just so you can see some of the neurological exercises, a lot of them have to do with retraining eye and head movements. And we start seated with these exercises, and then as you get better with them, we typically get you up and moving so that you're balancing or dual tasking or moving, while you're doing these, so that it can really challenge the brain, challenge all these systems so that we can, bombard your brain with stimulation, try to get it to heal as best as possible. So most of the graphics you see on the left side of the screen, those are various types of eye exercises and head movement exercises. Now on the right side of the screen, those are the electrical stimulation devices I was talking about, okay? The one up top there with the two little prongs, that is the peripheral nerve stimulator that I use to stimulate nerves in the face. And then the device with the pad and the clip, that's what I use for vagal nerve stimulation. Now, there are a few ways that we can go about treating concussions, and the way that we do this, it really depends on the severity of your symptoms and really how much time you have. If possible, we try to do what's called a spaced out plan. And in a spaced out plan, we take it kind of, a few visits at a time, not too much. We see, maybe once, twice, 3 times a week where we're teaching you some therapies to work on. We might do some body work on you when we're in there, and we focus a lot on the at-home routine. So when we teach you exercises, you're doing most of your rehabilitation on your own. So you're practicing your exercises, 2, 3, 4 times a day, and most of the responsibility lies on you to get better. Now, we're obviously checking up on you and doing other things in office that you can't do at home, but it's really about guiding you on an at-home plan so that we can, give you a routine that's gonna work for you. And the goal of that is to start, with the basics that we need to do to recalibrate your brain, for lack of a better word, but then we start to move into, improving your activities of daily living, getting to a physical exercise routine, all that kind of stuff. Now, for people that are way more chronic, so people that have severe symptoms, they've lasted for a long time, they're every day and they're just not getting better, or people who are just in a rush and want to get better faster, there is an option called a 5-day intensive. And the 5-day intensive is a researched method to rehabilitate concussions in as short a period of time as possible. And how we do that is we usually do 2 to 3 office visits a day. I try to keep it to 2 with your last session at home doing your exercises by yourself. And we do that for 5 days straight. And the goal of that is to make as much progress as possible in as little time as possible. Now, oftentimes people do start to feel some improvements over the course of that week. I want to be clear, that's not really the purpose of that week. The purpose of that week is to try lots of different things so we can really hammer in and zero in on the primary therapies that seem to work best for you. So, what might take us a month or two of playing around in a more spaced out plan, we can do all that playing around in a 5-day period because I have eyes on you the entire time. We can do therapies in office that you can't do at home. So it just tends to speed the process a little bit. We also get to do, the stimulation therapies, every day, multiple times a day. So it just tends to be a little bit of a quicker process. But, we're very, very rarely all the way better by the end of that week. At that point, that's when we start to, space things out, kind of similar to the first method that we talked about, and see, how little can I see you, but still give you all the tools possible to get you as close to normal as we can. This is just, the primary study that came out a few years ago concluded that this 5-day intensive is a very effective way to rehabilitate these kind of concussive episodes. Now, here's the long-term goals. After we've, and I touched on this a little bit already, after we've, taught you nitty-gritty exercises to work on. You've been doing them, multiple times a day, and hopefully at that point you're feeling better. Not everybody responds to rehab, unfortunately, but most people do. Once you're getting to a point where you're, not having symptoms every day, you're starting to get your life back a little bit, we start to focus on the long-term goals. So first and foremost, we want to create a physical exercise routine for you. One of the best full brain activations is exercising, physical exercise. Now, in the early stages of concussion, this may be too much of a challenge. You may not be able to do this because as soon as you start to do any kind of physical activity, it flares your symptoms up. So that's why we tend to start with the more basic therapies and ease you into physical exercise. But long term, we want to get you exercising. Now, there's lots that comes along with that. We want to make sure you're not overdoing it because doing too much is not a great thing for you. That's why there is some coaching that comes along with building in these long-term goals. Now, we also want to guide you with your activities of daily living. If you have to do a ton of computer work, if you have to read a lot, whatever you do at home that tends to flare up your symptoms and give you difficulties, we try to work with you to figure out, okay, how can we best do these without giving you a likelihood of flaring up, just try to allow you to do as much as humanly possible without making you slide backwards. And this tends to get easier over time. The more time passes, the more you're rehabilitating yourself. You tend to find that these things that used to flare you up don't affect you as much. But in the event that they are still messing with you a little bit, we can kind of guide you on how to best manage those kinds of things. Obviously, we want to address any hormonal, nutritional, or inflammatory issues that you might have. If you kind of hit a plateau and we're not getting farther, sometimes there's something internally that might be contributing to that. So at that point, we may want you to speak to the functional medicine team to see what they might be able to do to help with that. And then really, we want to limit your long-term reliance on everything we're doing with you. We don't want you to have to do your therapies and exercises routinely every single day for the rest of your life to maintain asymptomatic. We're really trying to do whatever we can to strengthen your brain and your body as much as possible so that you don't have to rely on these. Brain health is important. I do like to recommend that my patients do some kind of brain exercises along with their physical exercise routine, but the goal is not to have this take over your life. Okay? We want you to have as good a quality of life as possible here, and it's very important for me at least that we're giving you as many tools as we can to keep you out of our office. So just a little bit of summary here. Again, concussions occur when the brain bounces around inside the skull. It's not about when you hit your head. So a car accident, a whiplash trauma, that is enough to cause a concussion. Big, big, big misconception there. Now, any part of the brain can be injured, obviously, as it's bouncing around, but the brainstem is virtually always involved. And that is why we experience a lot of the common concussion symptoms we do. Headaches, dizziness, nausea, fogginess, and tension and pain. Most common symptoms occur, again, because of this brainstem injury, and most concussions heal symptomatically within, 2 weeks to a couple months or so. So if you're dealing with this and you're fresh in it, please try to calm down. Stressing out too much about this can flare your symptoms up. So take it easy for a few days, try to get into your daily routine. If you're having lasting symptoms, get it checked out. But again, the large majority of people will heal within that 2-month range. And then finally, those that don't heal on their own, most of those people will still improve. We just need to figure out the right kinds of therapies, the right kind of exercises to strengthen your brain as much as possible so that you're not experiencing your symptoms or experiencing your symptoms way less. Okay, that is a very, very broad brush over concussion. It obviously gets more complex than this, but that should give you a basic understanding of what a concussion is, where it's coming from, what kind of symptoms it causes, and what kind of rehabilitative options there are out there for you. If you're suffering, please, there is hope for you. Reach out to somebody. If you can't see us, please let me know. I'll try to help direct you to the right places. Sometimes we can do virtual work. I want to make sure that anybody who needs help has some kind of help. So if you're suffering, please give the office a call, get on the phone with me, let me hear you out, and let's see what kind of progress we can make with you. I'm really looking forward to meeting you. Thank you everybody again. My name is Dr. Dan Perman, and I hope to see you soon.